Hi friends, I am Dr. Pratap Sinato. I have done the MD in Forensic Medicine. In today's video, we will start with cardiovascular poisons, the poisons which affect the heart. In that, first start with the Nicotiana Tabacum plant poison. The plant of Nicotiana Tabacum are all parts of the plants are poisonous except the ripe seeds. The dried leaves, which are mainly sold as tobacco or cigarettes, contains about 1 to 8% of nicotine and are used as a form of smoke, snuff or chewed. Each cigarette contains about 50 to 20 milligram of nicotine, which is the active principle of content in the Nicotiana Tabacum, of which 1 to 2 milligram is absorbed by smoking, whereas in cigar it contains about 50 to 40 milligram of nicotine. This is the image of Nicotiana plant. These are the leaves which are used for making of, which are dried, made in small pieces and wrapped around the paper and sold as cigarettes, which is smoked. Coming to active principle, the toxic alkaloid present in Nicotiana Tabacum are nicotine and anabasine, which are toxic. Less toxic include the non-nicotine. These are the three alkaloids which are usually present in the Nicotiana Tabacum plant. Nicotine has a purest form, which is also available. Is available as colorless, volatile, bitter, hygroscopic liquid. It is extensively used in agriculture and horticulture for mainly for fumigating, spraying as insecticides and worm powder. So it is mainly, it's also used as a pure nicotine, also it's available, and it is used mainly as for insecticides or worm powder. Come to absorption excretion of nicotine. Nicotine is rapidly absorbed from all mucous membrane, lungs and the skin. So whenever the person, mainly if the person chews the tobacco, that is like tobacco, it is absorbed from the mouth. It may from the, if it is smoked in the form of cigarettes or BD, it is absorbed from the lungs and it can also be absorbed from the skin. 80-90% is metabolized by the liver, but some may be metabolized in kidneys and lungs. It is excreted mainly by the kidneys. Coming to action, it acts as autonomic ganglia, which are stimulated initially, but later on it causes depression and blocked at the later stages. It also acts on somatic neuromuscular junction and afferent fibers from sensory receptors. Come to signs and symptoms. On GIT, acute poisoning, mainly if the person consumes in a fatal dose of nicotine, the poisoning occurs mainly in acute poisoning. GIT, there is burning as a sensation, nausea, vomiting, abdominal pain and hypersalivation. In cardiopulmonary system, there is tachycardia, hypertension, tachypnea, which is present earlier. Later on, there is bradycardia, hypotension and respiratory depression later on. Later on, there is cardiac arrhythmia also starts to develop. In CNS, there is meiosis, confusion, headache, sweating, ataxia, agitation, restlessness, hypothermia, which is in early symptoms. As the disease progresses, there is mydriasis, lethargy and convergence, and person goes to coma. Afterwards, the person usually die because of death occurs because of respiratory failure. Coming to fatal dose, 50 to 100 milligram of pure nicotine is fatal. It rivals cyanide capable of producing rapid death. After 50 to 30 milligram of crude tobacco, if person chews over 50 to 30 milligram of tobacco, it has similar content of 50 to 100 milligram of nicotine. The person usually die because of acute poisoning. Fatal period is 5 to 15 minutes. Treatment: wash the stomach with warm water containing charcoal, tannin or potassium permanganate. This is mainly to remove any unwanted or any unabsorbed leaves if it is present. So stomach wash is done. Then purging is done by colonic washout is done to remove again any remaining leaves or any tobacco chewed. Then mecalamelamine is the specific antidote which is given orally for tobacco, for nicotine. Then airway is protected, then airway is maintained. Then in mild to moderate poisoning, atropine is also helpful. Hexamethonium chloride is also helpful. It mainly contracts the peripheral autonomic disturbance and acts as a respiratory stimulant. Vasodilators is also given. Oxygen is given if the person is unable to breathe, respiratory failure starts to occur. In that cases, oxygen is started and symptomatic treatment is provided. Coming to circumstance of poisoning, it is mainly accidental poison, which is results from due to ingestion, excessive smoking and application of leaves or juice on the wounds or skin. It is also used for malingering purpose where the person feigns a disease. So malingering is nothing but feigning or falsifying the illness. So where the person can use tobacco for feigning the illness, where the person's tobacco leaves are soaked in water and for some hours and placed in the axilla at bedtime. It causes increase in temperature. It can spike the temperature. It can simulate like a fever. It is also used as suicidal homicidal poison, which is very rare. Coming to chronic poisoning, mainly chronic poisoning is because of person who is chronically smoker, which is present is seen in chronic smokers. The person may have chronic poisoning may occur in because of nicotine. Chronic poisoning may occur. Symptoms includes person may have persistent cough, wheezing, dyspnea, anorexia, vomiting, diarrhea, anemic faintness, tremors, impaired memory, amblyopia, blindness, irregularity of the heart with extrasystoles, and symptoms of angina pectoris may also start to develop. Who have chronic poisoning, if the person stops abruptly, they develop withdrawal symptoms, which includes intense urge to smoke, anxiety, impaired concentration, impaired memory, depression or hostility, headache, muscle cramps, sleep disturbances, increased appetite, increased weight, diaphoresis, and rapid respiration may develop some of the withdrawal symptoms which develop. To treat the withdrawal symptoms, usually the smoking is short period of maintenance is started, often followed by gradual reduction in 6 to 12 weeks is adopted. So, gradually the stoppage of smoking is done for 6 to 12 weeks for it's slowly stopped, so that the person may overcome the withdrawal symptoms. Next treatment is the nicotine replacement therapy is also started to counteract the action from smoking. So, nicotine replacement therapy includes use of nicotine patches products including like gums, transdermal patches, nasal spray, lozenges, and inhalers. Other thing includes buprenorphine, which can also be used in those who are unmotivated to quit. Clonidine and nortriptyline can also be used to second line of treatment for in case of to overcome withdrawal. That ends the Nicotiana Tabacum. These are my references. Thank you.